Steve Adubato here. We're talking the big picture in healthcare with our good friend Barry Ostrowski, President and CEO, RWJBarnabas Health. Good to see you, Barry.
Good to see you. Thanks for having me, Steve.
How quickly does this healthcare landscape change in the state and nation?
Well, in the nation, it's changed to a great extent already. New Jersey still lags behind in terms of financing healthcare. We're fee-for-service and open access for the most part. We anticipate that's going to change over the next 5 to 7 years, placing greater pressure on providers to live within a financial risk model that really doesn't yet exist. And of course, it's continually putting more pressure on consumers who are finding out-of-pocket responsibilities to have been increased, and navigating through a complicated healthcare system is always difficult. So I think we probably, because we've lagged behind in New Jersey in some of these developments, are going to face a rush of change over the next 5 to 7 years.
RWJBarnabas, this significant healthcare system, talks about making communities healthier. Describe it.
Well, we think that it's great to be able to help people who are sick and treat the conditions that they develop. But the real trick, the real mission, the real objective is to avert illness, to stop people from getting sick or developing these conditions. And the truth is, you have to get into the communities to do that. Each of our communities around the state have certain social determinants that in fact result in people getting sick. And so no matter how good we are at treating sickness, if we don't address those determinants, we aren't going to be, as far as I'm concerned, effective in pursuing the mission. So we've decided, our organization, we've decided to come up with a social impact investment policy.
Back up, a social impact investment policy.
Right.
Now, the word health care isn't even in there.
That's right.
Why?
Well, because health is a result of the lack of social impact in certain areas. So if you don't look at the residential quality, if you don't look at unemployment issues, if you don't look at the lack of activity in safe environments, if you don't look at the unemployment rates, if you don't look at folks who would like to be educated but can't be for a variety of reasons, if you don't affect positively those criteria, those issues, then you get bad health. So it's not so much the health in those programs that we'll be looking at, it will be the people. They suffer from certain social determinants which lead to bad health. And we're going to develop programs in each of our marketplaces and try to match up what we know with some of those social determinants and have a positive impact on it. It's one of those mission-driven notions that will in fact take generations before we see the true payback. But we think that's part of what we should be doing.
Now, we're going to be talking about the RWJBarnabas healthcare system, what the footprint really is. But to be clear and to disclose, Barry serves on the board of public broadcasting in the state as a supporter. RWJBarnabas Health is a supporter, and I've done a lot of leadership development for your organization as well. I know it well. But the footprint is significant for RWJBarnabas Health. How many counties? How many people are we talking?
Well, we cover 9 counties, and in those counties, 5 million people live.
5 million?
5 million. So in a state of 8.5 million, 5 million of our fellow residents live within the counties that we serve. Not exclusively, obviously, there are other hospitals and healthcare providers, but we have immediate access, and they to us, of 5 million people. And every marketplace is different. Neighborhoods in Newark are different than neighborhoods in Short Hills and Long Branch and Lakewood and New Brunswick and Rahway. So the program I'm describing has to be designed to get to the issues that are most relevant to those communities. It's not a one-size-fits-all. We have 33,000 employees, and we have 9,000 physicians who honor us with their business. We think we have the intellectual capacity and the clinical capacity to address these things. It's going to be very exciting for us, and I think when all is said and done, it's one of the ways that a healthcare institution like ours can be more than a destination for sick people. If we're going to be successful, then we have to invest in our communities. The towns in which we're located have to understand that we're there to make a meaningful, positive impact, not just simply keep our emergency department open, awaiting people who are sick.
But Barry, clearly you need partners to do this, because getting into the community, being more patient-centric, requires that the whole paradigm shift, and you're dealing more with religious organizations, you're dealing with social service agencies. You've been doing it all along, but isn't it even more important than ever before, right?
It truly is. And you know, Steve, because you've led this initiative to bring together small, mission-driven local organizations that are
Mostly
not-for-profit.
nonprofits, I was just going to say.
Exactly, not-for-profit, who struggle with resource to do and pursue their mission. You help us meet with them at least quarterly.
A community advisory board that we bring together.
Exactly. In this case, it's in Newark. So our plan is to support those organizations. They already have carved out an important mission. They already have a constituency of people who rely on them. So rather than duplicate in any form or fashion that which they're doing, we're going to make resources available to them so they can expand for their constituent users what they do. So if you put this all together and you have an organization like ours with significant resource and a whole array of great skilled folks, and you work in tandem with these small organizations, now I think you have the ability to really get something done. A small organization, as you well know, has a certain level of skepticism about a big organization coming in and saying, we're going to do something, and they're disappointed, and rightfully so, if we don't recognize that which they're doing to enhance the community. So in our case, they're closer, they have the trust of the community. So it's not our intention in any way, shape, or form to displace those organizations, but rather to support them.
But you know, Barry, before I let you out of here, what I'm curious about is this. Historically, hospitals, healthcare systems, hospital systems have largely measured, and if I'm wrong, you'll tell me clearly, have measured their success on how many patients have come into the hospital, how many babies are delivered, how many. It's a quantitative equation. But unless I don't get this, so much of what is going to be done may potentially not be in the hospital itself, but in the community. Then what's the metrics for measuring success?
It's a great question. So the metrics that ought to be used is, and they exist already, what's the health of the community?
The overall health?
The overall health. So how many people suffer from a variety of conditions that we know can be averted? You can, if you stop obesity, you're going to stop the raging plagues of diabetes, of cardiovascular, and of cancer. People don't realize that one of the most predictable markers for breast cancer is obesity. So those will be the metrics on which will eventually be adjudicated. The difficulty is that no one's ever wanted to pay for that.
Right.
So it's not like Medicare or any of the private insurers will pay you to keep communities healthy. They are solely geared to paying you when someone gets sick.
Fee for service.
Fee for
Different
service.
model.
Volume makes a difference. So we've got to change that. We think we're big enough to lead that change. And as I say, I think we have the resources and the talent to do it.
Barry Ostrowski is President and Chief Executive Officer of RWJ Barnabas Health. Barry, as always, thank you for enlightening us on a whole range of important healthcare issues that matter to all of us. Thanks, Barry.
Thank you. Appreciate it.
Stay with us. We'll be right back.